Hi, good evening. This is Dr. Randy Bach. Today's April 27, 2022, and I'm here with another episode of the Coronavirus Conversation, part of Viral Conversation. And I'm going to begin with an announcement. It's a personal one. My mother-in-law of 90 years age passed from this mortal coil today. Um, she had been living with us the last nearly 9 years in the basement as our honored guest and patient, essentially. Um, Back around 9 years ago, she had thought she wanted to be in hospice, and this is a few years after the loss of her husband. I think there was some emotional aspect to it. She had lost weight. She was about 80 or 90 pounds at the time, and members of her family were looking for hospice for her. I thought she didn't really need that. She needed care, love, and not being on her own any longer. Her mobility had declined, and I invited, along with my wife, we invited her to come stay with us. And we have kind of a partially um, amenable basement, like an in-law apartment, literally in this case. And she's been our guest for the duration. We've taken care of her assiduously. We've had some help from some wonderful people, and we've made some good friendships with those people. And it's been an enterprise, labor of love, and sometimes ardor for my wife. Um, and clearly, she's done far more than I ever could. And it was, a little bit of a struggle here and there, but mostly went as well as anybody could hope for and expect. And we had closure. All her adult siblings and her adult children and grandchildren, who were also adults at this point, came to visit in the last few weeks, knowing that she was on the final steps. She didn't have a firm diagnosis. She kind of had an atypical Parkinsonism, and she was very limitedly able to move around the last number of years. And even though we had one of those stair escalator type things, she never really availed herself of it, but twice in the last 8 years or so. And so we would have her up. We would have had her up for dinners and Christmas and Easter and things that she celebrated. But for the fact that she really didn't have much interest in that. And Nonetheless, she was compos mentis. She was able to do complicated crossword puzzles and engage in conversation, play kind of Scrabble-like word games up until the very end of the last month or so, when she became far more debilitated. So I offer this talk in her memory. Certainly she produced wonderful children, long-lasting relationships, and a lot of love as a result that followed. Um, I don't think she was always satisfied towards the end, but her favorite phrase, I asked how she was, she'd say, could be better, could be worse. I mean, that's a fitting epitaph maybe for many, many things, and possibly for her as well. So she was valued and she'll be missed. But I bring her up in another aspect for this conversation because she has been the focus of a fair amount of our conversation regarding COVID-19 over these last few years, because literally she has been in our basement and under our care, and we have not done anything extraordinary in her regard. We felt always it was more important that she have personal relationship with us, and as a result, when we were not ill, we didn't wear masks. She never wore a mask. She kept up with the vaccinations, but I have to say, there was. I mean, she would have had a fourth vaccination if there was one around. She had all the shots and the booster and so forth, but it was, somewhat inimical because, on another sense, she knew she didn't really want to be around forever. She could hardly get out of a chair. Frankly, it needed, sometimes one or two people to help her get even out of a chair. The last number of years, so it's not as if she had a great traversing of her sphere very much. She wouldn't even agree to go outside. We had strong people here living in the house, and would have lifted her and so forth, and wheelchaired her around wherever she wanted to go. But never that was the case. So I had kind of a in joke, which was that she was happy as a clam for the duration, insofar as a clam might be happy in the same aspect, staying in one small enclosed space without moving very much or doing very much. But I think that it was an interesting, as a total sidelight, and I don't want to impinge on her memory, but it's not been a shock for us. We've known for quite some time that these were her final days and weeks, and frankly months and years for the duration. And it's something she wished as well. So we engaged with hospice and a priest, and she was as prepared as possible. And frankly, she left with honor and dignity. Her daughters, principally my wife, sat with her and did work downstairs just to be with her, and held her hand even when she was not communicative in the last little bit. So there's a lot of lessons here on the length of life. It's not infinite, and the ways possibly to handle it. We managed to avoid, putting her in a nursing home, although she had been essentially nursing home level of health for the duration, these 8 years. She has not been mobile at all, and and there you have it. But in terms of some of our previous conversations about COVID-19, there's the aspect, along with not putting her in a nursing home and avoiding the impersonality of a nursing home. We try to avoid the impersonality of kind of zombie land of avoiding facial contact. So my wife and my sister-in-law would go down and play a Quiddler game with her. It's a word game, or other kind of games of that sort, card games and whatnot, and never wore masks. Her home health aides were under our private employ. Some of them would wear them on occasion during the worst phases, but Arella never did, and we never did, frankly, unless there was some sniffles or something like that. So we treated it rationally and reasonably, understanding that she wasn't really signing up for infinite life, nor was it ever to be given to her, and nor was she capable of absorbing that in any event. So, I think you have to have kind of a sense of life and a sense of its termination and so forth. And so, she lived officially till a point at which, as of I think yesterday, Dr. Fauci declared the pandemic over, the pandemic phase of COVID-19 officially over. So we don't really necessarily need his proclamations or his declarations in that regard. But it is mildly ironic. She did not die from COVID-19, and she went through it. And again, nothing extraordinary on our parts. And that was so that she could have the essence of home. And she had home cooked meals throughout. My wife made her meals twice a day for 9 years. And that involved a lot of curtailment of our own activities, trips, mini vacations, or staying out late and whatnot, because there was a certain timetable. And at times, Arella had other needs, when she was more sick from urinary tract infections or colds and whatnot prior to COVID-19. And so there was, curtailment of our activities, but it was all part and parcel of kind of ushering Arella to, and to and through this end phase of life. So I don't have any deep um, insights regarding, say, hospice or the end of life and so forth, but you have to kind of treat it with the knowledge that that is where we are all headed, hopefully at a good length of time after our full capabilities, and that we've done the things we want to in life. So I recommend that you carry on and live life and enjoy it and so forth, with the understanding that it is finite. I don't wish death upon anybody, but I also don't wish absurd kind of over caution and what I call safetyism regarding the life that we do have. And again, so there was one kind of irony towards the latter phases here. We had a hospice team come in, which was different from our regular team of private nursing aides, and they insisted on wearing masks all the time. They were here. They wore masks outdoors when they're talking to us. And I'm kind of maybe slightly pedantic, stubborn, guy, although really charming and witty and fun and nice head of hair. I'm joking, but yes, literally they would wear a mask when talking to us outside, and so you get this muffled conversation. And what's really the point? It's just kind of weird theater. And they say, well, they have to because their employer says they have to. I said, well, Arella is you're here because it's hospice, and hospice means end of life. And Arella, I think, if anything, would like to, see people. She doesn't get out. You're going to come see her, and why not afford her the luxury and the dignity and the honor of having face to face communication. But no, they wouldn't do that. So they're kind of uh, busy little bees doing this and that. And they did all their official things. They changed her bed type. They brought in kind of a lift at certain points. A lot of probably, Medicare hard cost expenditures that somebody's paying for. I guess maybe us. I don't know. Maybe all of you. Um, and there's just kind of a weird machinery involved that doesn't have much rationality. Um, and they were, I think even if they had their druthers, they would still be wearing the masks. But I told them, I would absolve them because, in fact, Arella had a few weeks at most to live. Um, anyway, there you have it. And it wasn't. I mean, it was a point they started coming when Arella was up and as far as she was up and about. She was sitting in a chair and doing her card games and watching TV and so forth. In the later weeks, maybe it didn't matter as much. They were very effective at providing pain medication, about which I had, say mixed feelings because they gave her methadone, which is an opiate, and it really knocked her for a loop. So she was not really able much to speak after they started dosing her with that. Then she stopped eating, stopped drinking, and there was death. Now, I don't think there was really very little capability on her part, and we're talking maybe a matter of, precessing, kind of bringing the death date forward by a few weeks or something like that. I think that's immaterial. That's not my point. But they have their own little routine, but I don't think it necessarily always is in accord with kind of the wholesomeness in the sense that we were trying to apply for the duration. Anyway, so I'm going to maybe segue from that a little bit, and I extend my deep condolences, and I have to all members of her family, including my kids, for whom she was a grandmother, and she is their last remaining grandparent. And there you have it. So what else is in the new in the world of COVID? Um, well, you know, I think our world works on rumor and it works on feelings in a sense more than science. And a lot of these I'm going to try to point out tonight, that a lot of what you might have been fed along the way is um, more what people want to be true in their sense and sensibility. A little bit like the hospice people wearing masks. They do it because they do it, and not necessarily because it's the right or best thing to do. Um, hopefully we see a change in this. Um, you know, the um, the purchase of Twitter by Elon Musk and taking it private, I think, is a hugely sanguine event for humanity, such as we have it. It is kind of the public sphere. I think there are a number of them. There's, Google, there's all the TV networks, and then the social media sphere, Facebook, Twitter, Instagram, and all that kind of stuff. But to have one that is going to be open for free speech is an amazing thing. And this is really our bulwark. This is our genuine vaccine. The genuine virus, I mean, there's a virus, there's a COVID virus. I think it was real all along. But, say 45% of its, mortality victims were nursing home quality, such as my mother-in-law. And even amongst that population, I think during the worst phase, only 13% of nursing home contacts with the virus perished. So even for them, it was, maybe 1 out of 7 or so, 1 out of 8 individuals who contacted it died. So that's bad. But on the other hand, those are individuals who would have lived absent a COVID vaccine, maybe only a few months anyway. So my mother-in-law did manage to survive COVID. She never got it, um, and uh, and yet she passed nonetheless. So I guess yeah, I don't know if happiness is involved in that. Um, but the point is, we treated it as we saw fit. We used rationality, and I think that's the way things should be handled. Uh, Rationality requires reason. I think it is probably the similar word, um, but rationality is also like refers to ratios, where you have to weigh one thing versus another. And what we've had so often is the ratio where we care about certain things far more than we care about others. And I'm going to try to spend some time on certain of those now. If you have any questions about anything I've said, please let me know. Um, let's see, what was a good ratio place to start? Um, let's see. So there's an article here. Um, uh, I'm going to maybe pop this into my stream. This is from the Brownstone Institute, which I recommend. They have really interesting stuff. Martin Kulldorff, he was one of the Great Barrington Declaration principals, along with Jay Bhattacharya and Sunitra Gupta, maybe, from Oxford. So Stanford, Harvard, and Oxford. And yet they were pilloried and scorned and shunned and scarlet lettered by doctors Collins and Fauci back at the initiation of the declaration, I think in maybe the spring or summer of 2020. And all they had said was, as part of the Great Barrington Declaration, was, and it's mentioned here, um, uh, was to be sensible, to have what's called here focused protection, um, and in which the vulnerable would be kept safe, such as we did with my mother-in-law, and the rest of us, children and young adults, would be able to get on with their lives. I know pretty much for a fact that Arella LeBlanc would have wanted that. She, um, towards the end, maybe got a little more kind of self-centered, but I don't think she wanted her granddaughters to stay indoors for a couple of years, such as maybe elderly might have, or be masked, or avoid a life of dating, which might help further their chances of starting their own families down the line, nor her grandsons either. Um, anyway, so here's, yeah, I guess I got this right. There's Bhattacharya, Kulldorff, and Gupta, um, and Francis Collins and Anthony Fauci wrote a private letter, and they called these three fringe epidemiologists who deserve to be the subject of a media takedown. And this actually happened. And so the Musk news is big because Facebook and Google followed suit, and Twitter, I'm pretty sure, did as well. I had Jay Bhattacharya on my show maybe 2-3 months ago, and I recommend you watch that. And he was here talking with Reason Magazine's Nick Gillespie, I think. So what else? So here we have Dr. Fauci, the U.S. out of the pandemic phase of the COVID-19. Yay! That's sort of so obvious. Anyway, so here's the article I was bringing up that Dr. Kulldorff today or last week wrote. Have people been given the wrong vaccine? And I'm not going to read everything from this, but the real point here is this is a Danish study, and this is one of the only ones that was done in a randomized controlled trial. So what is that? I mean, the best kind is double-blinded, randomized control, where neither the patients nor the doctors know who was getting what treatment and so forth. But in this case, I'm not sure it was a treatment one. So, these type of studies, randomized, help to avoid bias between people who are watching what's going on. So I'm not going to get into the details of the study, but you can click through to this and find out the study. But to cut to the chase here, maybe I'll make this a little bit bigger. There was overall very little benefit of either of the vaccine types, but insofar as either one benefited, the older version, the adenovirus vector, such as were in Johnson and Johnson, AstraZeneca, had a difference between the deaths of the vaccinated versus the deaths of the controls. So this was mostly in the young, healthy group. and they had 16 out of 70,000 in the vaccinated group die, and 30 out of the control. So that was good. I mean, mind you, there's both minuscule numbers. They're talking about 30 out of 50,000. That's literal, less than 1 in 1,000 people dying in these age groups. But lo and behold, it was a little bit better amongst the vaccinated. Amongst the mRNA vaccines, there was no difference. So this, I don't know. I mean, it could be that the vaccine giveth and the vaccine taketh away. So far as it might have been protecting against the COVID-19, it might have its own set of problems and symptoms amongst the younger people. I don't know if you've heard about this one, but you should check it out. I'll give a link to it. What else is in the new world of COVID? I mean, there's still, things hanging around over our heads regarding COVID-19. And here you might, remember from the last couple of weeks, we've talked about Shanghai. These are, this is mass testing in Beijing begins. Those who refuse risk prison time. So everyone's standing outdoors. They're all healthy, and they all have to be tested. Craziness. This is a great quote from Albert Einstein. Two things are infinite: the universe and human stupidity. And I'm not sure about the universe. Why we have to do this, and so, and here it's written, because health, with people stuck together in huge line for hours. So if in fact there's going to be, anybody catching anything, then getting everyone together is certainly not a way to avoid that. There's some other things going on with Twitter. This is on our own shores. I don't know if you can hear the audio or not, but this man records school teachers refusing to say whether they have gotten parental consent of kids being tested on a random basis. Where is this? I'm not sure where this is, but this is the U.S. And, this has just been kind of a weird kind of tale, the tail wagging the dog, and we are the dog, they're the tail. They are a little bit like the Wizard of Oz. They're not using magic, but they're using force and the concept that they have to be right in order to make people do the things that they want them to do. This is, these are not teachers' kids. Joe Biden just, I guess, yesterday was saying while they're in school, they are teachers' kids. They are not. Whose kids are they is really the question. They're your kids. They've never been at any risk of having illness, and here they are still masked. Tiny little kids, a couple years into this. This is pointless, and then they're being tested. They're getting stuff stuck up their noses. This is a wrong message to be giving to kids ever, and certainly now when all of this is all done. I don't know why Shanghai is going through all this, but they are under the People's Republic of China, Communist Party. We so far are not, but we can't act that way. We have to be stronger. Along the same lines, the Pfizer is asking the FDA to authorize COVID boosters for kids 5 to 11 years old. So in light of the fact here that these mRNA boosters don't really do anything much to reduce younger people's mortality anyway, and given that kids don't have the illness at all, why is this going on? I don't really know. I don't have an answer for that. It's a little bit ghoulish to have keep persisting, kind of terrorizing young kids, and they are your kids. You have to figure this out. You just rely on them to do it. They're going to think for you, and they're going to do stuff for you. I think I mentioned this before, but the city of I'm not subscribing to the New York Times, but the city of Philadelphia. Let's see if I can just redo this. The city of Philadelphia wants to reinstate the mask mandate. I don't know if they went ahead and did that or not. They need to be fought back, and the opening up of Twitter is one of the places where people can start fighting back for public opinion. A friend of mine brought this up today. This is the World Health Organization page, and they're talking about COVAX. working for global equitable access to COVID-19 vaccines. I'm not sure that's completely necessary. The concept here is that the poor countries should get vaccine in concert with and at the same pace with you're getting it. So if you're paying full freight and you have to give extra ones for, obviously there's 330 million people in the United States and 7 billion people worldwide. Um, Potentially you'd have to give out, if it's just the United States, you'd have to give out 20 vaccines for every one you develop for yourself in order to have complete so-called vaccine equity. But this is, my friend was pointing this part out. With a fast-moving pandemic, no one is safe until everyone is safe. That makes literally no sense. If you have a vaccine, you think the vaccine works, you've had that vaccine, you are safe. So you wouldn't necessarily need to vaccinate everybody on Earth for anybody else to be safe. And frankly, if you vaccinated some of the more mobile people, such as Indonesia did early on, the vectors for vaccine, you'll probably do better than vaccinating the people in the cul-de-sacs, nursing homes and so forth. I mean, it's fine to do them at some point, but the people who are the transmitters, if you kind of game theoried this, you do them first. So this is sort of nonsensical. This kind of becomes one of these equity concepts. Vaccine equity. It's only impossible until it's done. Well, sure, but they don't necessarily need the same vaccines. In Africa, for instance, where I'm not actually, I don't know if this is Africa, but this looks like India based on the Sanskrit in the back. But parts of Africa, frankly, most of Africa really didn't suffer much at all through COVID-19 in terms of mortality and whatnot. Maybe they weren't data collecting, but in large part, it's probably because the population is younger. I think it's a full, life expectancy is probably 15 years less through most of sub-Saharan Africa, aside from Union of South Africa. Or country of South Africa itself, than it is, say, in Japan or good vast swaths of the more industrialized Western countries. So they probably need, when you devote all your money and time into this kind of mythical problem, given that money is finite, you are avoiding, say, potentially yellow fever vaccines or malaria treatment, so forth. The health dollar, if you kind of slow everything down, you're going to be probably, crippling your own efforts at treating COVID-19 for the elderly, which we have more of here, and then you would be helping problems where they're for the young there. So if the problem in Africa is malaria and you're giving them COVID-19 vaccine, you're not really helping. You think you are. You're doing virtue signaling, but you're not necessarily helping. As far as this may be cutting back a little bit, but this is an article from 2003, I believe. As far as the pandemic phase of the United States out of the pandemic phase of COVID-19, he says that we're never going to get rid of this problem. Here you go. The health advisor warned, we're not going to eradicate this virus. Well, sure. And the reason is because they mutate into and they self-attenuate into milder and milder versions. So this is going an article way before Corona, COVID-19, or it's kind of coincident with SARS, I guess. But I just want to point out that a good fraction of the common cold always has been coronavirus. There are more rhinoviruses. We don't have vaccines to rhinoviruses. We have vaccines to influenza. We don't really, I think they'll probably come up with some vaccines to RSV, but we don't have one to adenovirus or enterovirus and so forth. So a lot of these common colds are common, and they're common colds. They're just get a cold, some sniffles and so forth. You don't need to shoot every mosquito with a shotgun. You don't need to shoot every cold virus with vaccines. And so you need to get some rationality. COVID, I don't know how these other coronaviruses got there to be common colds, but they certainly might have gone through the same pathway that this one did. I think there might have been a coronavirus, I think the so-called Russian flu from 1909 or something like that was a coronavirus. And what happened to that? It probably just, kind of self-attenuated down into a milder version. Right now, I don't know, what Omicron B12 or whatever it is, some B9 or something like that, whatever the number is. You're welcome to go pursue this, but obviously there are more important things going on around the world. And on a personal basis, we have some more important things as well. As I mentioned, I'm going to just see one of these um, comments here from a nurse I know. mRNA vaccines have had a scary track record with healthy males having cardiac issues. So this persistent push to keep vaccinated healthy is ghoulish. Not one healthy person should die to fuel big pharma profits. Well, bravo, and kudos to that. I think I might call it a day. On personal news, I am working on the print versions of my Overturning Zika book. You can find it on Amazon in the ebook version. If you want a paper version, that should be ready. I'm saying maybe within the end of this, by the end of this week. I am simultaneously working on a Brazilian version and a couple comic books to help explain the absence, the presence of an absence, the fact that Zika never recurred. These are your health people, your health professionals at work, and you should take them with a grain of salt. I guess I'm going to add one thing I meant to get to tonight. I skipped over it. And I'm just putting this is not quite pertinent to COVID-19, but this is your public health people. And I just want to, Michael Knowles pointed out to me, and I remember that, the root word of public health, publius, is the same basically as politics. And you should keep in mind that your public health servants might not be quite servants, but might want to be the bosses. And what they're doing is oftentimes in their own interests, political versus your interest as far as health. So the emphasis is probably more on the political part of public health than the health part. And so this doctor in New York City, I guess she's the chief medical officer at the Department of Health. She touted a new birth equity initiative to provide more midwives and doulas to moms, series of tweets. But the interesting part was that they got to be called these birthing people. I had a birthing person. I actually loved my birthing person. She's no longer with her. May she rest in peace. My mother. The urgency of this moment is clear. Mortality rates of birthing people are too high. And here's the funny part: babies born to Black and Puerto Rican mothers in the city are 3 times more likely to, et cetera. But here, Black and Puerto Rican get to be mothers. And every time it's not Black and Puerto Rican, here we go, are 3 times more likely to die in their first year of life than babies born to non-Hispanic white birthing people. So if you're white and Puerto Rican, you are a mother. If you're white and not Hispanic, you're a birthing person. I don't know. I mean, that seems sort of, it's called here racism and hate speech, whatever. I mean, I don't want to get too deep in this argument, but um, people have their own pursuing their own kind of agendas, and you got to be careful that you try to pursue your own agenda rather than everyone else's. I'm going to remove this. God bless my mother-in-law. I hope she has a peaceful passage and gets to enjoy herself in a more mobile form as a living angel that she was in many ways, joining her husband and her childhood friends and relatives. We'll miss her. And as far as how things are, it couldn't be better. It could be better, it could be worse. I hope things stay better for you. And if you feel so inclined, please drop by Amazon and find my book, Overturning Zika. I'd appreciate any reviews you can make of that, especially if they're positive. And I wish you a pleasant evening and I don't know, and peace in your own thoughts. Thanks. Have a good